And I want to say good evening to everyone. Thank you all for joining us. I'm really happy to see such a variety of folks joining us tonight. We have a number of professional caregivers, caregivers from organizations who are seeking information to be able to help the people that they serve, and also individuals who are caring for loved ones in their home. So I'm happy that you're all here for us. Now, if anyone doesn't know me, my name is Kimberly Connell, and I'm the Caregiver Services and Support Specialist with Onondaga County Office for Aging. And whenever I ask caregivers that I support what educational topics they would most like me to focus on for these classes, how to keep their loved ones at home and out of a nursing home is always in the top 5. And if that is the goal, having an understanding of any program or service that can help is truly important. And the goal of this class tonight is to help you understand one such program. And so I'm really, really glad that we can bring this information to you. And so tonight, on behalf of Onondaga County Office for Aging and Caregiver Services, I'm pleased to welcome you all to our Institute for Caregivers class, Understanding the Program for All-Inclusive Care for the Elderly, or the PACE program as it's called. PACE is a really unique program that many of you have probably heard of, but most don't understand. And so tonight, hopefully all that will change. The class tonight will be presented by Tammy Natoli, and we're thrilled to have Tammy with us. I want to tell you a little bit about her. Tammy is a registered nurse, and she has worked with PACE of Central New York for over 21 years as an intake coordinator. Recently, though, Tammy has been promoted to the Director of Marketing and Intake at PACE. And in this new leadership role, Tammy will play an integral part in promoting PACE of Central New York programs and services by developing and maintaining and implementing existing and new marketing plans that align with Loretto's business initiatives. This is rhythm, sorry. As director, Tammy will also supervise, educate, and develop and direct all intake specialists and admissions representatives to maximize their potential in reaching their personal and enrollment goals of PACE of Central New York. She'll also help support the career development and growth of other PACE employees. Tammy is a graduate of St. Joseph's College of Nursing in Syracuse, and prior to joining Loretto and PACE, she worked as a registered nurse with POMCO, which is a United Healthcare company, and as a charge nurse on the cardiac telemetry unit, and then on the endoscopy unit at St. Joseph's Hospital. Now, Tammy is a really passionate and knowledgeable advocate for PACE, and so we're in really good hands tonight, and I'm looking forward to it. Myself, I hope you all are, and I'm going to now turn you over and spotlight Tammy. There you go.
Hello, everyone. Thank you for joining us this evening to learn a little bit more about PACE. So I'm going to start the acronym PACE, Program of All-Inclusive Care for the Elderly. Tonight, I'd like to tell you a little bit more about PACE, who's eligible for it, what services we provide, and how we're paid for. And then lastly, how you could start the assessment process. So PACE started in California. ONLOC is primarily an Asian population, and that culture, they try not to place their loved one in a nursing home. They try to keep them at home, keep their strength up, really focus on prevention. So the government saw that ONLOC was saving Medicare and Medicaid money, because if you focus on prevention, you might prevent a hospitalization, just makes sense. So they passed legislation and they replicated this PACE model throughout the country. There's 148 PACE programs throughout the United States. There's 9 programs in New York State. PACE isn't always in the name, like the PACE program in Rochester is called Elder One. PACE in Schenectady is called the EDDI. But it's the same philosophy, the same goal, to help support families to keep their loved one, at home, maximize their independence, but, give them some help. So to be eligible for PACE, people have to be at least 55 years of age. They have to live in Onondaga County. That's our service area for our PACE program. And they have to be in need of long-term care services. And the way that is determined, there's a particular nursing assessment tool called a UAS, a Universal Assessment System. that people only need to score 5 points on. And it's not difficult to get the 5 points. If somebody needs help, in and out of a tub to shower, so bathing, dressing, if they're incontinent of bowel or bladder, all these things give points. Decreased cognition. So that's the eligibility tool that's used for people to, if that are interested in a managed long-term care program such as PACE. So PACE is a MLTC, a managed long-term care program of Loretto. And we've had our PACE program here in Syracuse since December of 1997. We have about 500 participants in our program. We have 2 PACE sites, one in North Syracuse called the Sally Coyne Center for Independence, and one in East Syracuse, the Catherine McAuliffe Center for Independence. So depending on where people live would determine which PACE site they're managed out of. So, if you give us a call, the main number to PACE is 315-452-5800. Or you could call me directly at 315-413-4579. Myself or one of the other RN intake specialists or intake screener will get back to you, could set up a meeting, meet you in your home, go over all the managed care pieces of PACE and, talk to you about how we're paid for and start the process. All the consents that you would sign initially doesn't lock anybody into anything. It's just saying you would go forward with the assessment process, that you could stop it at any time. And if somebody came into the program and wasn't happy for whatever reason, they could disenroll. Most people love it. They love having all the different medical people involved, trying to, again, keep their strength up and focus on prevention. So what we do is we come up with an individualized care plan that would include aid service, which is primarily to help somebody bathe and dress. Our day center, pre-pandemic, the day centers were bustling, all kinds of things going on. Our director of recreational therapist, Orion, does a wonderful job. Right now, because we're in the health emergency, which has been extended into January, we still have to socially distance everyone, and everybody has to wear a mask. So there are capacity issues on some days. But again, back to our services: aid service, day center, transportation to and from. You may have seen the PACE vans around town. The transportation is to and from the PACE site where their primary care would be. And to and from any specialists if something was going on that the team could not manage. I'm sorry, I lost my train of thought. So back to the services: aid service, day center, transportation, medications. We fill all the meds. No one has to go to the pharmacy to get your medication. And I'm going to talk to you about how we're paid for in a minute, but there's no copays for doctors, no copays for prescriptions. We provide incontinence products like pads or Depends, which can be very expensive. Lifeline if someone lives alone, or PERS, a personal emergency response. Sometimes Meals on Wheels, depending on their financial situation. So again, their care plan includes all this stuff, including durable medical equipment if it's medically necessary. Everything you can think of related to medical needs. We become your health insurance. So eye exams, glasses, dental work, dentures, podiatry. We say one-stop shopping for your health care. We become Medicare Part A, which is hospitalizations, and the choices with PACE are St. Joe's or Krause hospitals. Inpatient short-term rehab is Loretto Fahey. There are 2 nursing homes that do contract with us. It's Loretto and St. Camillus. But again, our goal is to keep people out of there if at all possible, and keep people in their home. So if you call, we'll set up an appointment, meet with you privately, and go over all the ins and outs of PACE and figure out if we have a payment source. So does anybody have any questions on our services before I get into how we're paid for?
This is Kimberly. I actually do have a question.
Sure.
First. So when you say you essentially become their insurance company, the insurance company of the individual who's enrolled, do they still maintain their Medicare or Medicaid insurance? How is that working?
So we get paid by Medicare and Medicaid. So they don't, if they go to the hospital, they do not present their Medicare or Medicaid card. They only show their PACE card because PACE is the only one billed. So, sometimes people have private insurance and they ask if they should keep that. We don't tell people to get rid of it, but it will never be billed while they're in PACE. So some people wait to make sure they like the PACE program. And then, because once they have Medicare and Medicaid, even if they disenrolled from PACE, they could still, possibly use our pooled trust and, different things like that. So does that answer your questions?
I think so.
So-
Now Tara also has a question. Hang on, Tara. I'm gonna, you can go ahead and unmute yourself.
Unmute yourself.
I did.
I think you're still muted. Okay, hang on. There you go.
Can you repeat your phone number again?
Oh, I will provide that for you all on the follow-up email as well, but you can go ahead and repeat that.
315-452-5800, or a direct dial number is 315-413-4579. And tomorrow I'm going to send to Kimberly a bunch of handouts that will give you guys what the Medicaid guidelines are, what's needed for Medicaid, our financial disclosure sheet that we ask, a lot of things that she'll email to you that you may find helpful. And also, if you went to our website, which is paceny.org, if you go under the community tab, we've put together an Onondaga County Community Resource Guide that you may find helpful if you're trying to kind of piece together what PACE does.
What's
right.
the cost?
Go ahead.
Sorry, what's the cost of the health insurance provided by Medicare? I mean, by PACE?
So, again, if there's no questions about services, we'll get into how we're paid for. So no private insurance pays for PACE. Medicare would pay for part of it, but people don't have to have Medicare because they could be 55. If someone only has Medicare and they're not Medicaid eligible, PACE is about $5,100 per month. Nursing homes are more than double that, but $5,100 is still a lot of money. So there's one sheet of financial info that we ask people to disclose, what's their monthly income broken down, Social Security, pension, and then what are their assets? How much in the bank? Do they have stocks, bonds, CDs, IRAs, annuities, and cash value on life insurance policies? The Medicaid guidelines for 2022, you could have $16,800 in the bank as an individual and still be Medicaid eligible. Some people have heard of spend downs. That's often, if someone has more income than what the Medicaid allowable amount is. Right now, the Medicaid allowable amount is $934 a month. Not many people can afford to live on that. Loretto has something called a pooled, POOLED, a pooled trust. It's a special needs trust so that seniors do not lose access to their income. So say your aunt who's widowed, she has less than $16,800 in the bank and doesn't have other assets, but she has, say, $1,334 a month. In that scenario, if Medicaid's only allowing her to keep $934 a month, she's $400 over, right? So instead of paying in a spend down $400 to have Medicaid services, if she uses the Loretto Pooled Trust, she would write a check for whatever she's over the Medicaid allowable amount, which this year is $934, to the trust account. And then the trust could pay out a bill, a couple bills, as long as it's for her sole benefit, rent, things that could be paid out of the trust, rent, National Grid, phone, cable. So some people end up with more money, after they pay the joinder fee to use the trust. Now, there's not a joinder fee for PACE because we get paid by Medicare and Medicaid, but Loretto charges a fee to use the trust, and they allow seniors to pay it over time. So they'll work with you to make sure it doesn't, create a financial hardship. So the Loretto PACE Finance Department offers a wonderful service free of charge, and that is applying for Medicaid for you. As long as you have not done an irrevocable trust with an attorney within the last 5 years, if you set up an irrevocable trust and it's been less than 5 years, the finance department may say you have to go back to the attorney and pay them to do the Medicaid application. Otherwise, we'll do it free of charge, and our finance department makes your life, a lot simpler with respect to Medicaid because they go down on your behalf. You don't even have to go down to Medicaid. And we don't, right now, we're not looking back, 5 years. That's more for somebody that's in a nursing home. So we're only looking back a month or two right now, as far as, what people have done transferring things. If someone does end up in a facility within, for more than 30 days, then that would trigger a 5-year look back. But without getting too in depth into the finances right now, that's what we look at. That someone would tell us what their income is per month, what their assets are. We look at the Medicaid eligibility levels for an individual, as I mentioned, is $16,800 in assets, and then income is $934. But you could use the pooled trust, so we're not as concerned about the income. Now, if there's a married couple and one person is in more need of services, there's something called spousal impoverishment Medicaid, so that the so-called well spouse doesn't become impoverished because of the care needs. The person not coming into PACE could have $74,820 in their name, and then the person coming into PACE $16,800. So, more than $90,000 plus a house and a car, and we can get Medicaid to pay for PACE. And usually they can keep around $3,500 a month. And kind of our finance department figures it out depending on which spouse has the income. But this spousal impoverishment Medicaid has been wonderful to, for someone to be Medicaid eligible and have that pay for the PACE program. Any questions so far? And so tomorrow,
This is Kimberly. I just wanted to let you know too that that in January, the eligibility requirements for Medicaid will go up pretty drastically. I think it's
yeah,
53%.
we're hearing that.
Yeah, $1,563. They think right around there. They're not absolutely positively certain, but it's around $1,500 at least. And for
Yes.
And also all of what you just mentioned will increase. So folks will be able to keep more of their income and assets. But it's wonderful what PACE does, how PACE actually helps with that. And the pooled trust from PACE, from what folks tell me, is just one of the best and least expensive and best managed pooled trusts that they can get.
Yeah, when I started with PACE, we didn't have the pooled trust yet, and there were so many people that needed, services, but they couldn't afford to live on, the Medicaid allowable amount. So the trust has been wonderful. There's other pooled trusts out there, like there's one, I think, in Rochester, the CDR trust, but I believe you're limited on how many transactions per month. But the Loretto Pool Trust has been a godsend, really, for the PACE participants. The majority of them use the trust, the ones that have higher income. Any other questions as far as how we're paid for? With respect to assets, there's certain, I'm a nurse, I don't do financial advice, but I've learned a few things over the years. Some assets, if they're qualified, can be put into distribution mode, and people can draw income from it, and then we don't have to consider that principal amount toward this $16,800. So there's different things that our finance department can, advise somebody. So if you want to, start the process, just give us a call. And like I said, you can stop it at any time, or, if you come into PACE and you don't like it, you can disenroll. Most people love it, and they love having all the medical people, again, looking out for them or their loved one. And trying to maintain them in their home, as long as it's, feasible. Take some more questions.
No, doesn't look like it.
Anything in the chat, Kimberly?
No question. Oh, yep. Here we go. Do you have to go to a certain doctor that are affiliated with PACE?
So the PACE doctor does become the primary care physician, and we have several providers at each PACE site. Actually, our PACE site in East Syracuse has 2 separate interdisciplinary teams. So all of our doctors are certified in gerontology or have some type of training in gerontology. So this is the population we really specialize in. So yes, the PACE doc does become the primary care physician, but we have a whole list of specialists that contract with us. Maybe the cardiologist or pulmonologist is on our list. We also have an opportunity for other primary docs in the community to become a waivered physician with PACE if they're interested. Our medical director can talk to them about, coming onto PACE as a waivered physician, and he'll talk to them about what that entails. But any change is hard for people, especially if they have a great relationship with their primary care provider. They don't like to change that. We say go talk to them, because we're getting a lot of referrals from primary care physicians. Not that they want to lose your business, but they realize they can't help people with what we call activities of daily living, ADLs and IADLs. If, the bathing, dressing, somebody that say was in the hospital and then was set up with certified home care after the hospitalization, that's not for a very long time. Medicare doesn't pay, there has to be a skilled need in there for Medicare to pay, and it's not usually a very long time. So we're getting a lot of referrals from primary care physicians and from certified home health agencies, people that they have to cut services, but they know they're going to need ongoing aid service, that type of thing. So yes, the PACE provider does become the primary care physician for the PACE participant. Thank you for that question.
Nothing else yet, Tammy.
Okay. So I was talking about that nursing assessment that determines medical eligibility. Right now, it's being done by the New York Independent Assessor. So it's an independent nurse that does that assessment. But pretty soon, people are going to have a choice of PACE just determining eligibility ourselves by doing that assessment, or you could still go, through the New York Independent Assessor. We're just waiting for a date for when that starts.
This meeting is being recorded.
I wanted to mention with the pooled trust, the pooled trust is not offered for spousal impoverishment Medicaid, but if both spouses are on Medicaid and come into the PACE program, we can use the pooled trust. So do you guys feel like you have a good understanding what the PACE program is? The
Tammy,
whole philosophy.
Can you repeat what you just said about the pooled trust? I didn't quite get it.
Yeah,
So for people, the pooled trust is for people that, so that they can become Medicaid eligible and still have access to all of their income. The only difference is, who's paying some of the bills. So it's like having 2 separate accounts. They have their regular bank account, and then there's the pooled trust account. The Loretto pays out the bills that is agreed upon with the PACE participant. There's certain things, like I said, it has to be for their sole benefit. We had somebody, they wanted to pay their grandson's car payment out of it. That's not legal. But if it's internet or National Grid, phone, cable, so they write a check to the pool trust, and then the pool trust will pay the bill. So ideally, what you have coming in to the trust every month to get the full benefit would go out every month. Upon death, the trust takes 50% of what's left in the trust.
Mhm.
So that's why you want what goes in to come back out. What I was saying is, an individual, single person, divorced, widow, widower, we can use the pooled trust if they have what Medicaid considers high income. But if somebody is Medicaid eligible because of spousal impoverishment Medicaid, we're not able to use the pooled trust. But with a married couple with one spouse coming into the program, they're usually able to keep around $3,500 a month in income.
What is a
Okay.
pool trust?
Question
What
about the
is-
trust?
What is a pool trust? How is it set up?
It's a special needs trust that is managed by the Loretto Foundation, and I believe M&T Bank is still doing it with them. It's so that whatever your income above the Medicaid amount, so that you don't have to pay it to Medicaid or pay it to the program the Medicaid program that you're joining, you put it into the pooled trust and you still have access to it. It's just the pooled trust has to pay that money back out.
Okay. And at the end, when you die, then
Well, if you have anything left in it, the trust, it stays in the trust. 50% stays in the trust, and then 50% would go to a beneficiary. But that's why I was saying you really want what you put into it every month to come back out in bills. So, if somebody has really, really high income and not a lot of bills per month, that may not be the best situation for them to let the trust build up, because they do risk, losing half of it if they pass away.
okay. Now,
Tammy, go ahead.
is Loretto manages PACE, or is it PACE independent of Loretto, and Loretto just does the bookkeeping?
So our PACE program is a Loretto program. It's a
Okay.
managed long-term care program of Loretto. So they are, like I said, other PACE programs, some are hooked with hospitals, some like a PACE in Rochester, Elder One. I believe they're still affiliated with Rochester General. So yes, Loretto is our parent company, but we got PACE here December of 1997.
So the PACEs around the country are independent.
Right, it's the same philosophy. I have someone, that is in a PACE program in the Buffalo area that's going to be relocating to Onondaga County. So they can't just transfer within the PACE sites, but it's an easy transition. It's just the Medicaid is per county. So it's, how should I say it? So we already know they qualify because they've already been enrolled in PACE. So we don't need that medical eligibility done again. We just need them to have Onondaga County Medicaid. So that just takes a little bit to get the Medicaid switched over from one county to another.
Thank you.
Okay, and we have one other question in the chat. Tammy, is there a maximum amount that you can have in a pooled trust?
Our finance department, Christine Stanford and Michelle Murphy, they could probably answer this better. But when we first had the trust, some people were putting in a lot of money. They were, wanted to use it to maybe save for a roof or, really, expensive things that might come up. And it was a big risk. So right now it's really just used for income. So for someone to be able to use the trust, they still have to be Medicaid eligible based on their assets. And then income wise, there really isn't a limit, but like I said, for you to get the full benefit of the trust, you really want to have enough bills to submit to the trust to use up everything every month. Like what I said, what goes into it. If you're putting in, $1,000 and you're keeping the $934, the Medicaid allowable in your regular account to pay whatever, because you have $1,934 a month in income, the $1,000 that you're putting into the trust, do you have enough bills to use up that $1,000 every month? People that have rent or mortgages or that might work out great for them. But it's usually like rent, utilities, car payments, car insurance, renter's insurance. Some people will pay, companion programs in addition to PACE privately, and that can be billed out of the trust. There's really not a limit. It's just you're risking leaving, whatever money is left in there upon death, you would lose.
So Tammy, however, the PACE program, if an individual chooses to go that way, will review with them what their income and output is in order to advise what they may want to include within the trust.
Right. There's certain things that can and cannot be paid out of the trust. So the Loretto PACE Finance Department will talk to them about, their specific situation.
Yeah. Okay, good.
But, PACE isn't a perfect program for everyone, but it's wonderful for, people that have chronic illnesses. I've seen it make such a difference in people's lives, often, especially the sandwich generation, they're working to have, sometimes have children, little kids, and now they're trying to help, take care of their parents as well. So it really, supports the whole family.
Right.
And there's a lot of communication. There's a social worker assigned with the PACE program, a nutritionist. We have our own licensed home care agency. So there's an RN case manager from home care. A lot of, again, the focus being prevention, trying to keep their strength up. We have a falls prevention program at PACE, at each PACE site. The PACE clinic is there. Then we have a rehab department. And what's unique with PACE, remember I was talking about a certified home care agency, say St. Joe's or St. Joe's Home Care, HCR, any of the certified agencies, St. Camilla's Home Care. For them to get aid service, there has to be a skilled service in there, like nursing doing something, or PT or OT. With PACE, we can provide maintenance therapy. It doesn't have to be restorative. With a certified agency, it has to be restorative, meaning the person's going to improve. But once somebody plateaus or regresses, they have to cut that service. We follow different rules with PACE, so we could put an aid in indefinitely.
Okay. So PACE does provide home health aides as well.
Yes, we have like I mentioned, we have our own licensed home care agency, and we also have a contract with St. Camilla's Home Care.
Excellent. Excellent. Because really it's just geared to help keep that individual home and out of a nursing home. Okay.
Right.
So,
and we can
go
give
ahead.
the personal care. Most people like the personal care and, the privacy of their own home, but say their home isn't conducive because the wheelchair doesn't fit through the doorway. We have a beautiful personal care area at our East Syracuse PACE site. Actually, we in North Syracuse as well. We can shower people there if their home isn't conducive, as I mentioned. The aid service, though, is very task oriented. It's not someone, we don't have someone just sitting with them in case they have to get up and go to the bathroom. It's to, help with the bathing or the dressing. And then the day center piece, at PACE, they would get a big hot lunch. And then we look at what they're doing for meals on other days. We don't have somebody that comes in and prepares meals, but if they can't do microwavables or family can't provide the meals, we would look at Meals on Wheels for them. At PACE, as I mentioned, there's all different activities. They're using what's called a Grand Pad right now, where they can connect with other PACE participants, and the participants are really loving that.
Wow. So I think since the individual who's enrolled in PACE is not paying for healthcare essentially, then paying for additional companion care out of that trust is a really great way to spend that money.
If they need that, that would be somebody that needs that physical presence of someone all the time.
Yeah, and a lot of people do, yeah.
Right. So, but sometimes, they just need the help with the personal care. Often it's medication management, they're forgetting to take their meds, so whether they're taking them out of the vials or they're using the little medi sets, days of the week. We have different things that we look at. Our home care nurse will look at, what they're doing and if it's working, and if it's not. We have medication dispensing devices, a Medicube, all different things where we can, make sure that they're being compliant with their meds, and that they're getting their meds and not forgetting them.
Yeah, excellent. Yeah, no, it's
The day
excellent.
center. I'm sorry.
No, it's excellent. I mean, and I think both is needed. In my experience in talking with caregivers, both is needed. And what you provide, what PACE provides in the home, is what's often missing for the caregiver at home. Companion services they're able to get, but what you're asking, be able to deliver is different. But I think both is really important.
Right. And
So-
with PACE too, if they go into the hospital, we communicate with the discharge planners at the hospital, with the goal always to return back home as long as it's safe. Sometimes we can put people in respite for a little bit. Sometimes they need inpatient short-term rehab, but there is that communication with our home care coordinators and the hospital. So, and that's another thing that participants love about the PACE program, is our team gets together every morning at morning meeting. They would know, if Mrs. Jones fell the night before, they can adjust her care plan as things are happening with her. The communication and the coordination of care is wonderful.
So Tammy, there's a couple of other questions for you.
Okay.
First of all, does PACE pay monthly bills for the participant? I'm not sure what she means. Maybe the insurance is what you're thinking of, or?
Well, no,
I'm
some
not sure.
people have like representative payees. So say someone's mother was forgetting to pay bills, or was just getting confused paying the bills. We don't pay their bills, like our social worker doesn't pay the bills, but the trust will pay whatever is set up to be paid out of the trust. So, many of the bills may be paid from the trust, but often it's not all of them. So if the trust, if enough money isn't being put into the trust to cover all the bills, they have to come out of the amount that Medicaid allows them to keep. And that's where a representative payee could get involved to do that if family couldn't take on that piece as far as bill paying. Does that answer your question?
Jean, does that answer your question?
Yes, it does. Thank you.
Oh, okay. Thanks, Jean. Okay. And then Chris asked, would someone with dementia be a good candidate for this program?
Out of our, around 500 participants, a significant number have some type of cognitive deficit. So, dementia is a broad term, Alzheimer's, vascular, multi-infarct, all very similar, short-term memory loss, and unfortunately progresses. You just don't know how quickly. Yes, the thing is, the main reason that we cannot offer enrollment to someone is safety. So if someone's already wandering out of the house, and the police are bringing them back, because we don't physically provide someone in their home all the time, in that type of scenario, living with family is the best option. So yes, we have many people with dementia in the PACE program. They just have to be safe in the community, and, safety, are they leaving the stove on all the time? Sometimes the stoves can be turned off. Some seniors with dementia, say they, if they've been in, say, a senior apartment for a very long time and they're very familiar with their surroundings, we've had people do very well. You just don't know how quickly the disease will progress. It's different for everyone. So when it when there is a safety concern, that's when we would look at recommending other options for them. You know, sometimes Loretto housing is an option in between. It kind of depends if if there's an opening and can they afford the rent. Like Loretto has the Heritage Apartments that's just for the dementia population. So, we wouldn't recommend nursing home right away. It would only be if there wasn't someplace else, that they could be kept safe in between home and nursing home.
And Tammy, if the individual is living, say it's the parent of an adult child, and the parent is living with the adult child, are they still eligible for the PACE program? So if the adult child is working or simply can't, manage everything?
That's an ideal situation, actually.
It is?
Mhm.
Okay, excellent, okay.
That's often where, if they do have a dementia diagnosis and the adult child works, that's where the day center is huge.
Mhm.
They don't have to worry about them when they're at PACE, but if, they, depending on their care plan, with the time that they're picked up and the time that they're dropped back off, somebody has to be there. So that's where, extended family or whatever, we work with them to figure out who's going to be that person that would be there when the PACE driver drops them back off.
Okay. Okay, so we have one more question. If you're up for it, hang on a second. I gotta pull this up. Okay, so can you talk about how medications are managed? Right now, I manage the medications for my sister, and there are 13 medications to be constantly refilling and reordering, etc. We currently use an electronic pill box and fill it each week.
So that's where our home care nurse will, look at what you're doing now, and if it's working, if it's working, you may not want to change it. If it's not working, that's where we would look at other options. If the person was coming to the day center, sometimes they, meds can be administered there. It sounds like you already have an automatic device. So there's there's different things that our home care nurse will recommend with respect to the medications. I'm not sure if the question was, we try to keep the family involved still, that's the best situation for the PACE participant. But if the family can no longer do some of the stuff that they were doing, we would explore how it could be done, especially with respect to medications. We have a couple pharmacies that we use. So like I said, no one goes to the pharmacy, as far as the PACE participant or their family. They can be delivered different ways. There's packets, there's the vials, there's all different things that our home care gets into.
And are you, is PACE ordering those based on the need, or is that up to the family or the individual?
The PACE doctor orders the meds, and there has to be an order for the medication, and then there's checks and balances in there to make sure that the meds are refilled and delivered.
Okay, so in that
everything's
case,
included. So usually they're filled generically unless there's a reason that someone can't take the generic version. But we look, a big thing that we look at is medication interaction, because there's been lots of studies with falls. I think 10 or more medications increase the amount of falls historically. So that is our philosophy is not to keep adding medications that can interact negatively with one another.
okay. So in this case, then Jean would not have to continually be reordering.
It would be up to her.
Reordering, unless
She wouldn't have to reorder. We would take
Right.
care of the ordering of all the
refilling
meds,
and reordering. Okay, right. That's
um,
what.
but she would fill her, if she has a medication dispensing device, sometimes
would-
family take that on and they do that. Like I said, we really try to keep family involved if they're able to.
Oh, yes, and I think if they have one of those dispensers, it's a wonderful thing. So you'd want to keep using that. Okay. Did that answer your question, Jean?
Yes, that was helpful. Thank you.
Yes.
Thanks, Jean.
Okay, no more questions now.
Um,
I don't know where you were, but
so I was just, thinking back if there was something that I forgot to tell you. To start the process, you just give us a call and let us know, should we contact the potential participant themselves, or, due to forgetfulness or whatever, if you want us to contact a family member, we just need a name and number to start the process. And then, we'll explain all the services and the managed care piece of it. And if they want to go forward, that's where they have to disclose some financial info so we can see if there's a payment source. And again, it's either Medicaid or private pay. And if they're Medicaid eligible, we'll assist with that process. And tomorrow, again, be looking out for the, I'm sorry I didn't have it ready for you today, but we'll get to you what the Medicaid eligibility levels are right now. But as Kimberly mentioned, they're going to go up in 2023. And then I'll send the list of what is needed. Like I said, we don't look back. We don't need 5 years of bank statements, so it's like a photo ID, even if it's an expired license, a social security card, a Medicare card, any insurance cards, the social security benefit letter. So there's a list of what goes with what documents need to go with the Medicaid application, and the family or the prospective participant can send it right to our financial department, via email if they feel comfortable with that. We don't even actually need a hard copy. Or if there isn't anybody that is able to do that, or say the senior themselves just doesn't, they don't email or go on the computer at all, we can come. We have a secure iPad that we can take pictures and get them to the finance department for them. So we really try to help every part of the process.
great.
And our drivers, the PACE vans, they have a hydraulic lift, so if someone needs to come in their wheelchair, I think the weight limit's like 600 pounds maybe. The vans are all heated. And like I said, that's to and from PACE and to and from any specialist if we've scheduled them with a specialist. And usually the specialists are used if there's something going on that PACE cannot manage. We would look at our contracted providers and make that appointment for them. And we would take them if family couldn't. We encourage family to go, but if they, sometimes due to their work schedule, it's easier for them to meet at the doctor's appointment if we, at the specialist appointment, if we get them there.
Mm-hmm. So so PACE also arranges for transportation to doctor visits.
Well, our transportation's to and from PACE, where the PACE doctor is in the PACE clinic, and to and from specialists if we order the specialist, right?
Right. Okay. Yes, I guess that's what I meant. If there's a cardiologist or neurologist or
But it's
and,
together.
any number of
Yeah.
specialists.
This is if you are part of this.
Okay.
I have a question.
Go ahead,
Um,
Margaret.
Yes, if somebody is not with PACE, we have a neighbor who lives by herself, and her sons are all out of town somewhere. And she needs to go to a doctor's appointment. Is there something call a bus service to take her there?
Yeah, our transportation is just for PACE participants. Often
Oh,
people
okay.
will see our vans and call and say, oh, can you, take.
That's what I want to know.
Yeah, we have put together the Onondaga County Community Resource Guide, and there's a table of contents. And if you
Yeah.
went under transportation, it would give you telephone numbers to a lot of different options. So our
Okay.
PACE website is pacecny.org. So pacecny.org. Or we could, mail you a hard copy if you gave us a call with your name and address. We could get that out to you. There's, depending different areas, like there's ANTS area, North Transportation Systems, which is out of Catholic Charities in Mattydale. I think they're up and running again. They have volunteers that'll take seniors to medical appointments in Baldwinsville. I'm not sure if Beeville Express is working. A lot of things have changed since the pandemic.
Yeah.
But Camilla's had Catfish. I'm not sure where they are as far as, transporting people, but there is Call a Bus. There's medical transportation options that are listed in that resource guide. But that's another benefit of PACE. It's, included. You don't have to worry about your loved one getting to their doctor's appointments.
Thank you.
And
You're
Margaret, at the county, we have a transportation coordinator, actually. Larry Matthews is a great guy. I can forward you also that information, but there's so many different transportation options out there. I know Catfish is working, but there's, it depends on where you live and what the need is. And just like Tammy said, what is the physical capacity of the individual who needs transport?
She's
So-
in her late 80s
I'm
and
sorry?
does not drive.
Oh, yeah,
Yes.
no, I meant,
Yeah.
are they in a wheelchair? Do they need, special equipment to lift them and
No.
get them in and out? So,
No, I've given her information about PACE and whatever. I have lots of information from all these senior talks that we go to.
mhm.
But she has two sons. One's in New Hampshire and the other one is in Ohio. So they come all the way here to take her to the dentist,
Oh,
to the hairdresser. And I
that's
said,
nice.
you have facilities here that can take you, but it doesn't happen. She's been living by herself for many years.
But Margaret, it's actually very nice that her children are coming to take her to the
Mhm.
dentist. No, it is. I mean, that's very nice. If they're not able to live here, to be able to at least come and accommodate her on some of those trips, I'm sure she loves it.
Yes, she doesn't mind. She doesn't even know her son's name sometimes.
Oh, wow.
But thank
And I
you.
think the neighborhood advisors are out there again, right, Kimberly?
Oh, yes, we have neighborhood advisors. I work closely with the neighborhood advisors at the county. We're all in the same area. So
Mhm.
if she wanted to talk with the neighborhood advisor, that would just give me a call and I can connect them.
Because the neighborhood advisors often can help seniors, different things, HEAP, all kinds of stuff, coordinate things for them. So that's where we, if PACE doesn't work out for whatever reason, we're, we try to stay well-versed on what is available in the community, so that we can refer people, to kind of piece together what we do if PACE doesn't work out financially or for whatever reason. So
I have a question. I have a question.
sure.
What's the maximum or the minimum limit of assets you should have to join PACE? The maximum assets, sorry, not the minimum. Maximum assets you have to, if you want to make use of PACE.
Is it for a married person or
Yes, for a married person.
for a married person? The person coming into the PACE program can have 16,800.
16.
The person not coming into PACE can have $74,820. That's the Medicaid allowable for spousal impoverishment Medicaid. But as Kimberly mentioned, those levels are going to go up in 2023. People will be able to keep more in income and assets.
Yeah, a lot
Okay,
more.
this-
I think the top amount is 30, like almost 38,000 for
So,
married, for couples.
38,000 for income and assets
No, for
Same.
assets.
of assets.
Mhm.
so
Income-
assets, bank accounts, stocks, bonds, CDs, IRAs, annuities. And they
So
ask. about
IRAs
life
can be
insurance.
exempt. IRAs can be exempt in certain circumstances.
Mhm.
So you'd want to check with the elder law attorney about that. But yeah, so I think the maximum income is somewhere around what, 2,400 in January for
I
couples?
don't have the new levels yet, so I've just
Yeah.
heard what they're gonna be.
I do. I have them in the office. But I
So
can't.
tomorrow, I can send you right now, it's, what it is for the rest of this year.
Yeah,
So PACE costs either, it depends if someone's Medicaid eligible or not. If they're not Medicaid eligible, meaning that they don't fall within the Medicaid guidelines and they're privately paying, the private pay amount depends on whether they have Medicare or not. If they have Medicare, PACE is about $5,100 a month. But again, we would see if they would qualify for the spousal impoverishment Medicaid.
and I'll send out the amounts that will change, the change in the amounts of the maximum income and assets that are presumed to be in January. Now, it
Yeah,
hasn't,
that's why I'm hesitant to give a
Yeah.
figure because it may change.
yeah, but it's definitely not going to go lower. They think if anything, it'll
No,
go.
it's gonna
higher, but
go
it's
up.
somewhere. Yeah. I mean, from the 1,500 or the 2,200 or whatever. So it's pretty much in that ballpark, just so you have an idea. And then just like Tammy said, even if you don't qualify because, in the impoverishment, oh no, wait a minute. If you're okay, I'm sorry, Tammy, let me go back over this again. If you are living with your spouse and you're not going to qualify for the spousal impoverishment Medicaid, you cannot lower your income using a pooled trust. Is that correct? Do I understand that correctly? If you're married and living
The
with your
pool trust
spouse.
is not, it's not offered in that situation.
Okay, right.
The pool
okay.
trust is for someone that's Medicaid eligible but has high income. And it's so they don't have a spend down. But for spousal impoverishment cases, the pool trust is not offered. It's only for an individual or if both spouses have Medicaid.
Okay. That's what I thought.
On our resource guide, we all, that table of contents, there's attorneys that that the Loretto system has worked with in the past that we know really specialize in that area of law, elder law, estate planning, that stay up on all the changes with Medicaid. Because we would recommend that you go to someone that really specializes in that area. If you're going to do any estate planning, as far as there's different kinds of trusts, there's revocable, which ends up being an issue for Medicaid because you can revoke it at any time and get that money. Irrevocable, again, I'm a nurse, but I believe that's the one that will protect the assets after 5 years if someone stays out of a nursing home.
Yeah, we just had education on that from Tim Crisafulli from Crisafulli and Gorman. We did a series of classes and still there's so much to know. But I do recommend anyone, any caregiver or anyone anticipating needing care and wanting to stay in the home for as long as possible to first of all, have at least a consultation with an elder law attorney and, get it all on the table, what you have, what you don't have, what's available. And then also, if you're thinking of it at all, I would recommend, calling PACE and having them come and do a consultation with you also. It's certainly not going to hurt, right, Tammy? And it may be, a real blessing for you.
Absolutely.
So,
So again, you only have to be 55, but you got to score 5 points, and it's not hard to get the 5 points on that nursing assessment.
right.
You know, people think, because a lot of the literature will say, you know, nursing home eligible. So that is kind of makes people think, oh, I'm not nursing home eligible. I would never qualify. But depending on what's, going on with them, as I mentioned, there's all different things that give points, and people only need to score 5 points to be medically eligible.
So that's not a PRI? Tammy,
No, so as I mentioned, there's all different kinds of nursing assessments out there.
Yeah.
PRIs are used for nursing home placement.
right.
There's the UAS is what PACE and
The UAS.
the Loretto Assisted Living uses. There's a DMS-1 that's used for frailty, for say Malta House and Malta Manor and O'Brien Road apartments. Those are senior independent apartments. There's a big misconception that they're assisted living, but they're not. Malta House and Malta Manor are connected to our PACE site in North Syracuse. And there's a covered walkway. Because we have so many people in PACE that live there, it was economically feasible for us to have an aide in the building. So that's why people think it's like assisted living, but if they're independent apartments owned by Loretto, but managed by Christopher Community. So they're low income HUD housing. If people are looking for affordable senior apartments, they could go to christopher-community.org and they can apply online to 5 different apartments with 1 application. So Malta House, Malta Manor, and O'Brien Road 1 and O'Brien Road 2, those are the only apartments out of all the ones that Christopher Community manages that has that frailty clause, where people have to score so many points on DMS-1. And we, the PACE nurses, do that DMS-1 to see if they determine, if they meet the frailty. So.
Okay. Tammy, what is the capacity of the heritage apartments for individuals who are living with dementia? And is there much of a turnaround? I don't want to say turnaround. Is there a wait list? Is there? Do you know?
They're a Loretto program, and I would recommend you talk to Stephanie Deacher. Stephanie Deacher is the admissions representative there. She's also the assistant administrator. Mary Koenig is the administrator. It's just dementia housing, but they have different programs in that building. They have enriched living and they have assisted living. And then we do have some PACE participants that live there as well. I think what you're asking, Kimberly, is when do they have to move, or when, there's retention standards, there's regulations that they have to abide by. So I believe, somebody can't need more than like a light assist of 1 person to toilet and transfer them. Like if they needed any type of mechanical lift, that exceeds what the regulations are. But Stephanie Deacher would be the person to ask for the heritage.
Okay, thank you so much. I know
Sure.
one of the caregivers that I support, her mom just recently went there, but I wasn't sure, and there was no wait list at that time. So I just.
Well, there's a wait list for the ALP, they call it ALP, the assisted living program, because there's only so many that are allotted for those slots. I'm not sure what their capacity is between enriched living and assisted living and the people that are in PACE. But I think they're usually pretty full, sometimes when the disease progresses, they may have to go to a nursing home. It just depends. Like I said, if they end up needing a mechanical lift or something like that.
Okay.
I may have Stephanie's number with me. I can give that to you.
Yeah, and I'll include it as well in the follow-up, just in case anyone is interested in exploring that option.
Could
And you can email that to me too, Tammy, if you want.
Okay. Her telephone number is 315-413-3039. Stephanie Deacher, Deecher. But yes, I will.
Okay, I got it though.
Could you send us the resources of those 5 points that you check people out, whether they require PACE? assistance?
The eligibility tool, it's a very
Yes.
long, it's done through the health commerce system with the
Mm,
online. And they're really, now there's not a tool that shows you the points. Like it may say, can the consumer walk and then turn themselves around.
mhm.
Really in this assessment, the nurse is answering a bunch of questions and the nurses do not know what points are being allotted until the very end. It calculates the points.
Okay.
But just from doing it over time, I know that, like I said, incontinence, even if say, a woman manages it themselves with pads or Depends, that gives a couple points. If you need help getting in and out of a tub because your balance is poor and you have a history of falls, that gives a couple points. If you have some arthritis and it's difficult to do buttons and zippers and snaps, or you get dizzy bending over to do socks and shoes, or you have shoulder pain and it's hard to pull things on over your head, help with bathing, dressing, toileting, memory, cognition is a big part of it. So it's not hard to get the 5 points.
Because we had a couple. She was 87 and he is 96. And she had some more health problems than he does. And she said that they were evaluating them, but nothing ever happened and they really needed help because they live by themselves, getting into the bathroom. And then she said that she was okay because she had a bar in the tub for her to go in
The
and
grab
out.
bar. Mhm.
Yeah, but she couldn't. And then she died in the end.
Oh, wow.
Yeah, I
Yeah,
wonder
so-
who's evaluating her. There's a lot of different programs out there, but for MLTCs, managed long-term care programs, such as PACE of Central New York, Nescentia has one called Options. Fidelis has a bunch of different programs, but they have an MLTC. iCircle has an MLTC. So the eligibility criteria for all these managed long-term care programs, which are community-based.
Yeah, they
programs.
wanted to stay in their home, but at the same time, I had given them information. It didn't happen. Then we have a couple in the husband is at the Heritage. They both have dementia. He's a little better off and she doesn't recognize anybody. They're both in their 80s.
Mhm.
Where's the other place for the dementia or Alzheimer's patients at Loretto?
Well, the Heritage is the one that is specifically for dementia.
So
The
they're
other,
on different floors, maybe?
no, the whole
No.
apartment building is for dementia. The other Loretto housing, some do have dementia, as long as there's not, like I said, if somebody would wander out, the other buildings such as Sedgwick Heights on James Street, there's not anything that would stop them from wandering out. There's Buckley Landing in North Syracuse. There's the Bernadine Apartments down.
No, they're both here at Bright, where the Heritage is.
Loretto.
At Loretto. One is in the Heritage and the wife is in another room. They're not even together.
Oh, well,
That's
I don't think that's something Tammy can help with.
No, I just
Unless they're
wanted
in the PACE program, but yeah, you want to talk with
Yeah.
them. But different
Thank you.
facilities have different floors and some, most every facility has a dementia wing or unit or more than one.
Yeah.
And if the spouses have different levels of their,
Dementia,
different levels, and they may be in two
It's-
different places. It's very sad, but
it is sad.
yeah.
And all this happened during COVID, so we don't know where they
Yeah.
are.
Yeah. Sad. But I would recommend, Margaret, if you're out there being an ambassador in the community for other people who are lonely and in need, ask them, share with them about the PACE program. Ask them to
I
call.
did.
If it works for them, then that's great, Yeah,
I gave them the flyers. My friend who passed away, I mean, she was
Yeah.
like my family.
yeah. Well,
Oh,
good. I mean, you can only do what you can do, Margaret, but
Yeah,
definitely keep doing what you're doing. It's wonderful that you care so much.
Yes, thank you, Margaret.
thank you.
So are there any other questions for Tammy?
oh, Tammy, hi, it's Ruth Troy. Thank you for doing this.
Oh, hi, Ruth. Ruth from Canton Woods, everybody.
Hi. I just wanted to ask, is there a respite piece for family caregivers if they need to be away or something?
Yes.
Through PACE?
So if they're in PACE and say the caregiver was going on vacation, we do offer respite. So it depends on what the care needs are as to where they would go for the respite. You know, sometimes people are at Malta's, sometimes O'Brien Road, sometimes, you know, we put them in different Loretto housing sites, you know, depending on what their care needs are. But respite is available for that reason. And,
Oh,
you know,
they don't
also,
stay at their home. They don't stay in their home. For the
Yeah.
caregiver.
that, I think Ruth is referring to somebody that needs the
He's
caregiver
going away.
available and they're going out of town. So, you know, you want everyone, safety's the thing that everyone looks at first and
Oh,
foremost.
okay.
You have to be safe, you know, so
Okay.
we do offer respite. But the goal of PACE, yes, you're right, sir, to keep people in their home.
Mhm. Yeah,
Thank you.
excellent question, Ruth. I didn't, here, I'm gonna put myself on too. I didn't even think of that, and respite is so very important to caregivers. So critical, when you're caring for someone in your home and have I mean, gosh, a wedding or want to get away for a weekend. You know, it's wonderful that PACE has that option for you.
And
So-
again, once the day center opens up a little bit more, as far as not having the socially distanced people and the mask wearing, that gives caregivers much needed respite too, you know, they can go get their hair done or go grocery shopping and they don't have to worry about their loved one when they're, you know, at PACE. There's medical people there and home health aides that'll help them right in the bathroom. And so
Right.
just getting a
Exactly.
little break, a little support to charge your own battery, right?
Yeah, you need that.
Exactly. Yeah, wonderful. I mean, as I tell so many caregivers that I talk with, you know, PACE is not for everyone, but for those who it works for, it's absolutely wonderful. It's really a godsend. And really takes a lot of distress and anxiety that every caregiver faces away, whether you're a long distance caregiver or a hands-on caregiver. It really takes a lot of that stress away. So I really appreciate Loretto and the PACE program all over the state. I absolutely love. So any other
I truly
questions?
believe in
Yeah.
the philosophy of it.
Oh.
23 years later, I'm still here.
Yes, I know. That's why I said Tammy has been a part of Loretto and the PACE program for 23 years now. I thought it was
Starting my
20.
23rd, yeah.
Wow. Wow.
I have a question.
Go ahead.
For respite, you don't have to belong to PACE. That's just a temporary phenomena, right? You just want to go few
And
hours
there's
for a
different places
hairdresser.
that offer respite. Yeah, there's the Heritage sometimes will offer respite. You know, so a lot of different agencies have you don't have to be in PACE for the respite.
No.
Okay.
No, you don't. If you are not on PACE, I mean, I talk with caregivers all the time. It's not as easy to get these days as it was because of COVID. COVID changed the landscape tremendously. So a lot of facilities who were providing respite are no longer, or there's really long wait times, or you need to prepare months and months in advance to give them notice. It's really not as easy these days, and you really kind of need to plan ahead. So it's but it's available. So if anybody who's here tonight, wants more information on that, just give me a call. Okay, I think we're coming down to it. Are we, any more questions for Tammy? Does everybody feel like they understand PACE a lot more now?
It's complicated.
It is. it's complicated and it's simple in a way as well, because it's all inclusive. I mean, that's, the very beautiful part about it is it's just all inclusive. The more complicated part, I think, is the financial aspect.
Is the
of it.
financial, but
Right,
we help
right.
with that,
Right.
like I said, if someone's Medicaid eligible, we certainly assist with it.
Right, right. So, and as Tammy said, she'll be providing me with some handouts, some information that you'll be able to have in your hands to refer to understand the eligibility and what all is included. Everything's included. It's all inclusive. So anything you can think of almost. And
Related
you
to
know,
healthcare needs.
yeah, and for healthcare, right? I don't think they're going to go shop. They're not going to go shopping for you. But if you call your neighborhood advisor, we do have shopping services available for people. So there's so many different options out there, to help, for those sorts of things. So Tammy, I just can't thank you enough for taking the time at the end of your very long day to spend with us and to help educate everyone who joined us tonight. I hope you all learned a lot. When I send out the email tomorrow, you'll have contact numbers to reach out to with all the additional questions that you're going to have, and maybe set up a meeting.
Yeah,
To
I
see-
really appreciate everyone's time tonight.
Thank you
Yeah.
very much.
Yeah,
Yeah.
thank you. Thank you
Absolutely.
for
Thank
doing
you,
this.
Kimberly.
Thank you. All right, Margaret. Yes, thank you
Have
so
a
much.
good night.
So, oh, there's Rhythm. He's saying good night too. Time for his dinner, I think. Okay, thank you all so much. We're going to say good night, Tammy. Email me tomorrow if you can, and I'll get
Absolutely.
the email out to the group. Okay.
Okay,
All
thank you
right.
very much.
Happy
Good night,
Good night,
Thanksgiving.
everybody.
Thank you so much.
Thank you.